Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Nephrin molecular series or edition. This audio podcast as part of a Tornado PlexAR. This audio podcast as part of a Monster Bostics, and this audio podcast as part of a Storm Robotics production. So, in around following the intro to this intro to this audio podcast, a little bit around sort of the clinical medicine, and in around the clinical medicine, but also a little bit around sort of the laboratory aspects around this sort of peer-reviewed and published works from 2014. So clinical medicine is generally a sort of a hands-on form of medical practice, but to emphasize how rapid changes in methodologies take place. So, for example, if yesterday's procedures or protocols, for example, those in, for example, general nephrology or renal medicine that may be used or might be used to treat young people today. This could mean a subtle but significant difference between patient mortality, survival, and morbidity sort of tomorrow. The immune system in young people or young patients become sort of compromised owing to infection, and renal replacement therapies or renal replacement modalities have and a variety sorry have a variety of can have a variety of complexities, but at the same time where the immune system in young people, or the immunology in young patients can become compromised owing to the variety of varying regimens. The physician needs to sort of have a sort of a knowledge and a basis on the on the elements around the immune system, immunology, and inflammation. The immunology specialty or discipline is uh, is generally is generally sort of generally sort of generally ha- generally has advanced in around aspects and linked where sort of laboratory and laboratory practices, but also laboratory sort of investigations pertaining to and linked to sort of pediatric nephrology have generally advanced, and stress needs to be placed on the diseases such as, for example, glomerulonephritis and hereditary causes, and strides have been made with regard to endeavors around transplantation transplantation. Um, in works by in one in works by yeah so in works by an author in around 2007. um, one author had informed sort of plasmapheresis based procedures are effective in removing both anti-human leukocyte antigen and anti-ABO and anti-ABO antibodies, and though not immediately utilized in young patients or pediatrics, but to appreciate nonetheless, and but to be appreciated nonetheless. And so the same author had informed in around 2007, the strategy may be helpful or useful for a smaller number of pediatrics or patients who have who have where specialists have investigated sort of other options, other sort of transplantation or transplant sort of options, and where there's been little or no success. Um, and so at the same time, comorbidities have or have become have become a sort of a problem owing to where patients amongst pediatrics and those with varying forms of renal disease, the procedures such as peritoneal dialysis, and sort of varying other sort of treatment and regimens. Um, whilst there can whilst there can be whilst there can be whilst there have been advances around varying treatments and procedures, the complications around around sort of where comorbidities are, um, uh, have have become important through general nephrology, but also in linking again back to sort of pediatric nephrology, owing to how detrimental young people how detrimental young people's sort of immunology and physiology, pathophysiology, can become, and so thus protocols, whilst there's protocols and advances are have improved in around in around prognoses for patients, for example, where patients have had where patients may have had for example, the 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 specialty of pediatric nephrology has generally had had a main has had a main sort of a main sort of ethos around sort of the importance of understanding the sort of pathophysiology against specific pediatric nephrology diseases. So at the same time, one of the sort of one of the most sort of topical, let's say one of the most sort of topical aspects around pediatrics and those young people faced with varying sort of comorbidities. For example, one of the topical aspects in young people and pediatrics um, has been has been uh, has been in line with sort of renal disease, has been cardiovascular. So cardiovascular has remained perhaps the most the sort of the second most common cause of death in children or young people on chronic dialysis, where young people unfortunately may have had to be on may have to be on or had to be on forms of renal replacement therapy, again hemodialysis for long for longer durations, and so for longer durations, and thus in children on chronic dialysis or post transplant or even post transplantation, accounting for approximately in documented works from around 2006 has been around has accounted for approximately 20 to 25% of all deaths. So pediatric nephrologists will need to attain sort of the comprehension and in around broad cardiology, and for example biomarkers surrounding cardiovascular and for example endothelial function, which are now which are and have been sort of popular clinical medicine sort of themes. So in regard to biomarkers, in regard to biomarkers, works published sort of in around 2004, and though retrospective, still important. There are two. The author in 2004 informs there are two forms. There are two forms around biomarkers. Biomarkers of exposure, which are utilized in risk prediction, and biomarkers of disease, which are utilized in screening and diagnosis, and monitoring of disease progression. Uh, and so, in around cardiovascular aspects, left ventricular hypertrophy and left ventricular dysfunction, irregular large arteries with raised intima medial thickness or IMT of the carotids have been accepted as early markers of cardiomyopathy in young people. In young people, and works and works for and So works also have informed that in following the sort of concepts, pediatric nephrologists also need to attain or should attain an understanding in the various modalities of measuring endothelial function. Now, bear in mind, endothelial function, although not a novel or novel concept, endothelial function and intermediate thickness or IMT became sort of had become more popular in around the late in the sort of latter parts for example between 2008 and up to 2015, for example, at least in the literature, amongst the literature and amongst the evidence, um, and um, and so um, and so the modalities for measuring endothelial function, which have become crucial or important, and not just for assessing renal disease, forms of vascular occlusions, where renal disease or renal function is concerned, but also where to sort of iterate further, works by an author in 2009 had informed the general principle of non-invasive evaluation of arterial structures based on ultrasound imaging of the arterial walls, allowing measurement of intermediate thickness or IMT, and for functional studies of elasticity. Um, and so again, such efforts in around tech have been sort of a basis in around clinical and medical practices bearing translational themes. Clinicians are also encouraged to possess the sort of necessary sort of toolkit to keep up practices in amongst respective field in regard to the specialty, by keeping up to date with evidence-based practices. So that draws this audio podcast to a close. This audio podcast sort of delving into sort of the underpinnings around the clinical medicine aspects of pediatric nephrology. This has been an audio podcast as part of the Nephrin molecular series or edition, an audio podcast as part of the Tornado PlexAR, an audio podcast as part of a Monster Bostics, and this audio podcast as part of a Storm Robotics production.